The race to combat the drug overdose epidemic across the country may face a shift in priority soon. The incoming Trump administration looking to focus on limiting the drug trade, he says. It's coming from Mexico and Canada. But those who work on the ground in hard-hit Michigan, just over the bridge from Canada, say a mix of tactics is necessary to really lower deaths. And they're seeing some success with dropping overdoses. Maura Barrett has a story. And we want to warn you that some of the topics discussed here are disturbing.
An urgent scene. Body cam video showing a first responder racing to save a life after an overdose.
29 hours.
A crisis faced across the country. Almost 500,000 deaths from drug overdoses in the last 5 years, according to the CDC.
Where am I going?
Here in Oakland County, Michigan, Detective Allie Michaels rushes into a dollar store with a new tool in hand, a medication called Opvee. The video, redacted by authorities, showing a woman lying on the floor, not breathing, a nasal spray,
First dose Opvee administered,
and chest compressions.
Will you take over compressions so I can start a timer? Do you have Opvee?
Yep.
Okay, I'm doing 2 minutes.
Within just about 2 minutes, a revitalizing breath.
She's breathing. She's breathing. That's crazy.
And a few minutes later, talking with the officers on scene and walking away from the place she could have lost her life.
Baby, you got medicine that you legally have to go to the hospital now.
I've had people who are turning blue. After 1 to 2 minutes, they will take a deep breath and sit up and look around and ask you why you're there.
This county had the country's first pilot program implementing Opvee, and along with its crisis response unit, has seen a 26% drop in overdose fatalities just since last year.
Hey! All right. Oh, yeah. You overdosed.
According to medical studies, Opvee is found to revive overdose patients faster and remains in their system 5 times longer than the already incredibly effective drug being used now, Narcan. The longevity essential for combating overdoses connected to long-acting opioids like synthetic fentanyl.
If there's an overdose, you have fentanyl in those drugs.
Point blank, there's the assumption there's fentanyl.
Thanks in part to the effectiveness of such drugs, it seems like America may be turning a corner on the epidemic of overdoses. The White House touting a 17% drop in drug deaths in the 12 months ending in July of this year, with hopes these new treatments can help even more.
What role do you see this newer medication playing in fighting the opioid crisis?
I hope to see it more widely used just because of the lives that it is saving at this time.
Now, with a new administration taking power, potentially a new focus, from stopping the deaths on the floor to stopping the drugs at the border, which is just a few miles from this Michigan county.
Not like the southern border, but they're coming in the Canadian border a lot, and drugs are pouring in. And I said to the president of Mexico and to Justin Trudeau, if it doesn't stop, I'm going to put tariffs on your country.
Based on what you're seeing, is that accurate that more illicit drugs are coming from Canada?
Well, it's coming from a variety of sources. So we need to secure our borders for a lot of reasons, including and especially drugs. So again, it's a whole of government thing. It's education, it's treatment, it's having a border that prevents more of this stuff from coming in, having China understand that's unacceptable. They have factories pouring this stuff out to dump into America.
Oakland County Sheriff Michael Bouchard says the federal government could save more lives by advancing what is working at the local level.
We've got to do all of this in concert with treatment, follow-up care. Once we save them, we just don't want to put them back into the same situation.
That's what Steve Norris does.
We can only continue to put a Band-Aid on this problem for a certain amount of time.
The director of overdose prevention and recovery support, part of the county's crisis response unit.
But I don't think there's a solution to a chemical problem with chemicals.
They've increased civilian access to Narcan, educated the community on the disease of addiction, and most importantly, provide connection to rehabilitation and recovery services for substance use disorder. Norris, in recovery himself, says that preventing access to drugs alone won't solve the problem, as addicts will find even more dangerous ways to get high. He stresses how important a human connection can be for the path to sobriety.
I wasn't at that stage to be able to accept that help for myself because I didn't think I was worth it. Being able to share that with people so that we can connect past that is how we get to the solution in general.
Compassion. Norris thinks it's missing from the incoming Trump administration's approach to the crisis and federal resources generally. He hopes an injection of love combined with the incredible reversal drugs can really help the people they serve and the nation turn over a new leaf.
And Maura is joining us now. That was a really good piece, Maura. Thank you for bringing that to us. How available is this new drug to first responders around the country? And as you mentioned, the incoming Trump administration, it is the federal government. Are they supporting the rollout?
So, Yasmin, Oakland County was the pilot program for Opvee, and they've been using that for about the last year or so. But in the last year, we know that there's been an expansion into other departments across 24 states. It's FDA approved, and it is available nationally for departments to get their hands on, get those officers trained. But it's something that right now the investment is only coming from the local level. There's a lot more that the federal government could do in terms of that support. That's why you heard the sheriff lay out that he wants to see the federal government take a page from what his department's doing. But everyone we talked to on this reporting trip emphasized that level of connection. I met Pepper Catt, who's a peer advocate, and she is a walking representation of what a second chance can look like. She and Steve are able to connect with people. Their whole responsibility as they go to talk to people after they've been revived from an overdose, for example. They connect with them within 24 hours. They provide a chance for them to not be lonely, to have that community connection, connect them with services and potentially resources. And this is something that other countries have explored in terms of combating their own opioid crises, is the compassion, the connection. And that's what these folks say is missing here in the U.S. and something that there is plenty of room for support from the federal government. Yasmin.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.